Hi guys, I'm here tonight to do a little video on my touch-up, and I just want to do a little touch-up on my hyaluronic acid on my lips and a few spots around my face. So right now I'm just removing all my makeup, which I've already done. I'm just going over it one last time. Make sure the area is clean. I just like to wipe down my pen before and after my treatments and all my tools. Beauty bar as well. I have my alcohol pad here, and I'm going to take it and I'm going to wash my beauty bar. This is the 24K Gold Beauty Bar. You can find that on my list of supplies, and it's great for smoothing out any kind of bumps. This is my ampoule. I'm using a 0.3 today. Pull it out. Take your hyaluronic acid and then you place tip to tip. Look, there's no needles on my filler, okay? They're packaged specifically for the Hyaluron pen. I only put it 3/4 of the way in because we need a little bit of room left in order to put the ampoule back. Next, untwist my pen all the way down till I can't twist anymore. Twist the ampoule into the pen. I'm gonna start with the dimple on my chin. And I'm going to do 0.01 ml injections. Notice I hold it there for a few seconds, and that's because sometimes the pen actually injects a half a second after you've released the injection. Okay, you see? So people are wondering if it hurts. It really doesn't hurt. The only thing I feel is kind of like an elastic flicking onto my skin. So you just want to wipe it every once in a while. Add a little pressure just so that it kind of spreads out the product while you're injecting. See, sometimes you get a spot of blood out of all those injections. I've only got one. So sometimes you're gonna see a little spot of blood, sometimes you won't. People wonder why. Just depends on the different parts of your face and the sensitivity to your skin. Some people bleed more than others. You always want to make sure when you're working on a client, you discuss any kind of health issues they may have. You want to know if they're on blood thinners. That could be a reason for bleeding. Blood here and there is normal. It's just if you see some people actually, especially when you're doing the lips and you're injecting and they're bleeding like every shot, it can happen because some people bleed more than others. No more dimple. So I'm adding pressure for about 20 seconds just to allow the product to spread out under the skin. Make sure there's no little bumps. Give it time. You want to have them beside you handy, because you'll need quite a few throughout your session. Usually the lips are swollen for about 48 hours, and I ice immediately after treatment so that the swelling is minimum. And as for like any freckle looking kind of spots that I get from doing my cheeks or anywhere else in my face, usually go away in about 3 days. But I do treat them every day with vitamin E as well to help healing quicker. So that's it. That's the dimple in my chin is gone. Now we're gonna move on. Take your time. The nice thing about the Hyaluron pen is the results are immediate, so you can see where you're going with that. For the lips, you don't want to take too long because the swelling will start to influence your decision making on where to put the filler. See around the mouth where I'm doing right here, along the edge, like I've done over here, that gives the mouth a little lift because as we age, we talk a lot, so that area tends to lose volume, that little triangle right there. So I'm just touching that up. You can see the difference. Okay, now you're going to see the difference on the other side too. I'm still only doing 0.01 ml shots at a time. I like to take it slow. I don't want any lumps. Now I'm going to add in more filler. It's evening up. There was more loss of volume on this side than the other side, so I did work on the right side a little longer. I'm not completely done yet. Okay, so I have a little bit more shallowness over here on this side. So do a little bit right there. Okay, so before I continue onto the next section, I am going to stop for a minute and I'm gonna beauty bar the area. Now that the lower part of my face is done, I'm gonna get back to my lips, but later. Just gonna go over it wherever I've treated with my beauty bar. Make sure everything is smooth. See, I don't want to take the lines completely away from here because that's what makes us look human. I don't like taking them away fully. So I'm going to do a little bit. I was more shallow here, so I did this side. I didn't do this side. And I'm going to do a little bit here because I'm more shallow on this side than I am this side. That's the area. So as you can see, we do go through a lot of alcohol wipes. Make sure you have them handy. So when you're doing the treatment, take your time, don't rush. If you do have a little spot that's bleeding, hold it for 30 to 45 seconds. What I'd like to do is add a little volume to my eyebrows. This. Look at that. See, it just adds a little volume. Okay, look at the volume. See that? Instant facelift. It's a liquid facelift without surgery. So far I've gone through two 0.3. So it takes 3 of these to equal 1 full ml. See, so you don't always need to put a full ml. That's why you can offer your clients the option. Sometimes if you want, you can charge per ampoule. Because if you're just treating a little area, like if I was just doing those little spots I did here, that would probably just take a 0.3. You have to look in the area you live in order to see what the going rates are. So I charge per ml, and I also charge per ampoule depending on what we're doing. All right, so now I'm going to move on to my cheek area. So now my eyebrows are done. All right, so I've talked about this before. Corner of the eyebrow to the cheekbone. Next, corner of the eye down to the cheekbone. I use my eye as a guide to where the product is going. Corner of the eyebrows done. Corner of the eye. I'm using my eye as injection guide. See, under the eye is a little more sensitive. There, they're gonna have like little spots along their cheeks, and it might take a few days, 3-4 days, in order for it to go away. And it's just a little more sensitive, so a lot of people experience a little bit of bruising, especially when it comes to the more inner part towards the eye. See, you just get little spots. I'm very sensitive. My skin is very sensitive to begin with, so all these little things show on me quite quickly. So far I've done 1 full ml. I'm gonna add a little bit more now. Okay, so my pen is loaded. That's the cheeks. I did a little bit of this. So when I'm doing under the eye, like that, directly, I do really just 0.0, like I do half a line. I literally just twist it a little, because I don't want bruising. I have a party this weekend. Okay, so I'm just gonna add a few little shots right around there, and then I'm gonna continue to my lips. And that will be it for tonight. My little liquid facelift. I'm doing like half a line, okay? So it's not even a 0.01 ml. It's half of that. Little turns. So I'm just smoothing the area, making sure there's no lumps. Now my lips. Tonight I'm using the 0.3 on myself. I like it on myself because it's a little smaller. It's a little easier to do on myself. See, when you have the right filler, you should not have any kind of product loss. All my product is going under the skin. If you're interested, you can email me at lc@hyaluron-queen.com. My hyaluronic acid is specifically formulated to use with the pen, so it has easy penetration with lasting results. Okay, so that's it. My lips are done, my cheeks are done, my dimple in my chin is done, and I did a little bit of the tear through under my eye. So that's it for today. I'm gonna let the swelling go down. I'm gonna ice it now. Don't forget to subscribe. And if you need to contact me, you contact me through email because my website is under construction. I'm gonna ice my lips with my lip packs, Hyaluron Clean. Look, aren't they so cute?